Welcome, everyone. So happy to have you here with us today. We're super excited to talk about University of Vermont's Integrative Health and Wellness Coaching Program. It is one of our incredibly exciting programs, and we have a jam-packed 30 minutes to get to information and all of your questions. Just some logistics. We are recording the session. We will share the recording out to everyone who has RSVP'd. Also, the Q&A box is where you want to place those questions. I'll keep an eye on those questions throughout the presentation. We'll do our best to answer them throughout the presentation, and we have plenty of time at the end to get to those questions if we haven't gotten to them yet. So let's get started. We'll do quick introductions, and we're really going to talk about why integrative health. What is integrative health and wellness coaching? What does that mean to be an integrative health and wellness coach? How do you get there through UVM's certificate program? And what then can you do with it, with that certificate and credential as an integrative health and wellness coach? And again, as I mentioned, we'll have plenty of time for your questions here at the end. My name is Nicole Lewillier-Fenton. I'm so happy to be with you today. I work in our professional and continuing ed department at the University of Vermont, and we're joined by Susan Whitman, who is our leader of our Integrative Health and Wellness Program, our coaching program, a lecturer in the College of Nursing and Health Sciences, and also on her path to be a PhD, or in the path to as a PhD student in interprofessional health sciences. And no surprise, her focus is in integrative health. So really looking that's why we're here today. So thank you so much, Susan, for all of your work on this program and leading this program and being with us today. Super excited to hear your insights. So let's start. Let's kind of back up a little bit before we get into some of the real meat of the program and how you get those credentials and applications and time frame and all that good stuff. What is integrative health and medicine, Susan?
Well, first off, Nicole, thank you for having me here. It's always a pleasure to come and talk about one of my favorite topics ever, which is health and wellness coaching, integrative medicine, all of these pieces. And I think this is actually a really important place to start because the lens of integrative health and medicine is really how we approach healthcare here at UVM and in our health coaching program. UVM recently became one of 11 Osher centers for integrative health around the world, meaning that we have this umbrella organization that is focused on education, research, policy, and clinical practices, kind of the four aims of an Osher center, all focused around integrative medicine and health. We're also members of the Academic Consortium for Integrative Medicine and Health. And all of these mean that we use this lens of healthcare to approach things instead of the normal pathogenic approach to healthcare, which is a lot of diagnose and treat. Integrative health has a salutogenic approach to healthcare, which means that we are focused more on how do we keep things healthy and how do you create an environment that creates health and wellness. This is the definition of integrative health. It has a lot of different pieces for it. Really, I think of it as whole person care, and that it affirms the relationship between the provider and the patient so that it's more of an empowering relationship for the person receiving that care. It is evidence-based. And I think of it, a lot of times people hear the word integrative health and they're like, oh, that's just complementary or alternative medicine. And we're like, no, it's not just complementary alternative medicine. It's not just conventional medicine. It's really the best of both worlds that come together with the person at the center of the care so that they can provide and receive the best care possible. So, why do we mention all of this? Well, I think of a lot of times, despite the fact that the United States is spending millions of dollars on healthcare every year, our outcomes really aren't the best that they could be. And right here, this article is talking about how lifestyle diseases account for up to 88% of deaths in the United States. And I'm a physician assistant by training, and I worked in the community health center here in Burlington for 10 years. And I would often spend my time using medications to diagnose and treat people. And I would often then say, Well, if you would just eat better, exercise a little bit more, get rid of the stress in your life, and lose some weight, you wouldn't have to be on all these medications and have all these things going on with you. But I don't have a lot of time to deal with that. So I'll see you in 6 months and good luck with that. So I didn't have a lot of time to focus on that. And a lot of healthcare right now, the specialists and the doctors don't have a lot of time to focus on lifestyle and behavior change. So that kind of leads us into this whole idea of health and wellness coaching. I must admit, when I was a healthcare provider, I sat down one day and I was just frustrated with medicine. I was frustrated with my job. I was almost burned out of healthcare because of my inability to feel like I was helping people. And I started just Googling whole person care or all these, I don't even know what I was looking up, but I came across health and wellness coaching. And literally, it was like a light shone down on my laptop and was like, this is what you need to do. And this is what we need more of. So I called up my husband and said, can I go to North Carolina in 2 weeks and start this health coaching training? So I went through the Duke Health Coaching Program back in 2011 and learned, I thought what I was going to learn was all about how to create lifestyle plans for someone. I thought I was going to become an expert in nutrition and an expert in exercise programs. And what I realized is that a health and wellness coach is not an expert in these areas, but a health and wellness coach is really there to, as an expert more in behavior change and in the behavior change process. There's someone who walks alongside the client and helps them figure out what's really important to them and how are they going to get those actions into play in their life, because that's where the challenge, I think, for most people is. A lot of people, they know what they need to be doing, and at the same time making it happen in a busy life, in a busy world, is really hard, and a health coach is there to help support that person.
So needed today. Oh my goodness. And I'm so glad that it's not that you really needed permission probably from your husband, but I'm so glad that you said, I'm going to go, and he supported you, because here we are today, right? And you had such a hand in some of the information on this slide as well.
Yeah, definitely. Once I graduated from my health coaching program, I continued as a physician assistant. And something that I thought was actually really interesting is that our health coaching program, going through that doesn't mean that you have to go and just become a health and wellness coach. You can come and learn communication skills, motivational interviewing, all of these, and apply them to your career. At the time, I had moved into an urgent care clinic, and I was working at an urgent care clinic, and I started to understand how to talk to my patients that I hadn't learned before. And I had people coming up to me and saying, could you be my primary care doctor? Because you're the first person in healthcare that I felt like has actually heard me, like heard my story and understood where I'm at. So using these skills that you could learn in this program also helps you become a better provider or practitioner in whatever your field is. Anyway, I digress from what this slide is from. Thank you, Nicole. And so I was practicing in private practice. And in about 2015, Kara Feldman Hunt and some other of the folks at the Lower Mann Center all came together, and they decided that we needed to start training folks in health and wellness coaching. There were no training programs in this area. And that they recognized that the strength of having these skills in undergraduates as they were starting their careers as healthcare providers could really lay that groundwork and that foundation. So it took us a few years to go through that whole process, but we launched our first program in the fall of 2019. We have graduated 10 cohorts already from our coaching program and gone on to expand from just undergraduates to including continuing education students to having programs just for continuing education students as well. And from this whole time, we have been an approved training program for the National Board for Health and Wellness Coaching, meaning that when you finish this program, you can sit for the National Board exam and become an NBC-HWC, lots of letters after your name.
And we will get into how our program prepares you for that and the exam in just a minute. And Susan referenced a variety of different options and course options for our adult learners. So we'll get to that information in just a moment. And I think this slide, kind of the next two slides that I know you're going to speak to, again, come back to integrative health. Like, what is our approach to this? It isn't just one way. It really looks at the whole person and all of the factors that might be influencing the choices or the choices that they want to make as they are reaching some of those goals that they identify. So I'd love for you to speak to this. And then I know the next slide is a great visual.
Nicole, you bring up such a great point. Like this idea, I think one of the hardest things for people coming through a coaching program is this expert hat that we often have firmly planted on our head. I had that coming in being like, I am going to figure out the best program for every person as they come through. It'll be individualized, but I'm going to figure it out. And recognizing that I don't know the best way for anyone that's in front of me to live their life. And now that I have two teenagers, I also recognize the more I tell someone what to do, the less they actually want to do anything that I tell them. And so when we're working with someone as a health and wellness coach, we don't just focus on diet and exercise. There is all of these other pieces that we talk about. And actually, if you go to the next slide, this all comes together. Each one of those is a part of our wheel of health. You'll find with a lot of coaching programs around the country that they have some version or some form of a wellness wheel. Ours was adopted as some of the areas that we use this as a tool for people to just take stock of their own health and wellness. For you to say, what makes you healthy and well? People will talk first about their diet, then about exercise, but then we'll push them a little bit further and say, how are your relationships and how are those fueling you? What is it that push and pull of work and life look like for you? How much sleep are you getting? And the fun, and how does spirituality play into your life? Where do you find awe, purpose, and meaning in your life? And the amazing thing, like I almost want to make this a web instead of a wheel because each thing impacts something else. And one of the exercises we do right off the bat is to say, okay, so if sleep isn't going so well in your life, what does that impact? And so if I'm not sleeping well, my relationships suffer because I am a little bit cranky. If I don't exercise or get movement in my day, I don't feel like eating well because I just kind of feel a little bit sluggish in there. So they all impact. And in the opposite way, when things are going well, then we're able to do these other pieces. So often it's like a puzzle. A health coach is often like a detective in many ways because someone might come in saying, you know what, I need to work on my nutrition. And what we start to realize as we talk with them is that the reason that they're not eating well is because they work 80 hours a week and they don't have time to do this. And maybe there's some change that needs to happen in their work life, cohesion there rather than just focusing on nutrition. Because if we try to make a change just in this nutrition area without really looking at the whole picture, we're just jamming a thing in there that will last for maybe 3 or 4 weeks and then it'll go away. So, we talk a lot about all the interconnection of all of these pieces throughout this.
And you've touched on something that I know we'll get a little bit more detail of some of the components of the program as we kind of shift in that way. But I keep hearing use of some of the skills that you gain of that motivational interviewing, that active listening. And so you've mentioned it without calling it as to that's what you're doing so often as a coach. You're really trying to, that's your detective skills coming in there and the tools that this program provides you to be able to do that, to get to what people are really trying to accomplish here. Again, just to plug, if anyone has any questions as we're going through the slides, please do put them into the Q&A. Happy to pause and get to any of those. And because we're going to shift now. So there's the overview as to kind of the why and the how we do things. So let's get deeper into what does our integrative health and wellness coaching program look like here at UVM? And some of the things that I just want to call out, and then I'll have Susan focus on a few more, is flexible learning options. We'll share in a few minutes of the different types of engagement that you can have with this particular program, the different times of year that, we have fall starts and we have spring starts. And so we have different opportunities to fit into busy lives as well. And really the end goal here, it could be that you want to be certified and you want to sit for the exam. That probably comes out in a lot of the discussions in the beginning, I would imagine. But we'll get you there if that is one of your goals. And, thinking about what Susan mentioned before is we are one of a handful of universities at the University of Vermont that is a certified OSHER Center for Health and Wellbeing. And so that opportunity to learn through our program comes with the backing of a Research One institution. And so that just lends itself to so many other opportunities for research and learning and opportunities and mentorship and areas of specialization. So Susan, maybe dive into those a little bit more for us too.
You bet. And as for some reason, I decided I had to go back to school. And one of the main reasons being that I kept saying, someone should research this. Someone should research this. And I've started to realize maybe I'm the one that needs to be doing some of this research. So as a PhD student, I am recognizing the importance in a nascent field like health and wellness coaching to have some rigorous scientifically backed research behind the effectiveness of health and wellness coaching. And we are actively doing research as a university on health and wellness coaching. Right now, we're researching health and wellness coaching in employee wellness. We have a group coaching program that we've been researching for the last 3 years, the effectiveness and showing how that program of health and wellness coaching for employees in a group setting is actually impacting their health and wellness. And we're doing some research on health and wellness coaching in developmental, the IDD population. So they're doing some research in that area. And my focus really is also on integrating health and wellness coaches into clinical practice. And what does that look like? And how can we create that type of thing? So coming on board here, you have the opportunity to be a part of research, to be a part of the academic institution here. In terms of mentorship, we have classes beyond our regular, just what gets you certified as a health and wellness coach. We have a practicum, one of the few places in the nation that offers a practicum in health and wellness coaching, where we do placements into different parts in the community where health and wellness coaches are working, and you get continued mentorship in that area. And if you are going towards the academic certificate, which we're going to work on and just talk about in just a little bit, we do have folks take continued classes in an area of specialization. If you're interested in working with different types of populations like employees or autism or different areas, we have classes that can help focus and give you a little bit more information upon that. I've also created a coaching collaborative that meets every other month. That's the Vermont Coaching Collaborative. Anyone that's been through our program, we get back together every other month and just talk about what's working and what's not working in their field and really learn and grow from each other.
So much more than just what's that certificate on paper at the end of this program. So thank you so much for going through some of that detail. And I teased this a little bit just because I've known you talk about it so often in past info sessions, but those big headlines here, really that motivational interviewing, that active listening, kind of weaving into some of those behavioral change theories. Just touch on, this is not inclusive of everything that folks will learn, but these are just some of the high points, I think.
Definitely. And you'll notice that there isn't a lot of focus. We do cover basics of nutrition and exercise and a lot of the health and wellness topics as well. But a majority of what we are focused on is how to listen, how to respond, and how to invoke intrinsic motivation in someone. So rather than me saying, you must do this, we want the person to come out of saying, I want to do this. This is really important for me. And how am I going to make this happen for myself? We cover a lot of different behavioral change theories. When I went through the coaching program, I know these were touched upon, but what I really wanted when we developed this program was for people to understand the why behind each part of the process. So when we say you need to give affirmations, which is one of the main parts of motivational interviewing, I want them to understand that affirmations come from positive psychology. And so we dive into a little bit of positive psychology for you to understand why we are doing and learning the tips and tools that we are, because coaching is kind of an amalgam of a lot of different theories. So we touch on a lot of those. Motivational interviewing is one of the core things, and we do have a pretty robust foundation in motivational interviewing. We spend at least the first 5 weeks really diving into this topic, and it's woven throughout the curriculum as well.
I've always heard students say that those two particular pieces, the motivational interviewing, the active listening, has permeated into everything else that they do. So it goes so beyond just, the health and wellness coaching or what they might be, trying to apply towards their career, that it weaves into their life. And I'm sure you've seen that happen quite a bit.
Yes, Nicole, you also have a reminder that's covering up the bottom part of the slide right there.
Yep. Thank you. Thank you, Susan.
And I was just going to also mention, we had a mother and son who just went through our program together, actually. The son was a student at UVM and the mom signed up independently. They both were on their computers and the mom was like, I think I want to take this program. And the son's like, I just signed up for it. And we had a big talk, like, how would it feel to have your mother in this class with you? And they talk about how it enhanced their ability to communicate with each other. We actually have a husband and wife in the program right now. But a lot of people, without even getting into the field, say that their relationships have changed and the way they communicate have changed. And that's some of the biggest impact that they've seen in this program.
I hear that. I think I hear that every single time I speak with a student. So I think it's such an incredible benefit that people didn't realize they would gain from it. So I want to be mindful of time. We've got about 8 minutes left. So please, if there's any questions, we're happy to. Hopefully we're just answering all your questions with all this great information. But also we do have an email address that we'll put up at the end if you have any follow-up questions afterwards. But we kind of teased this. There's a couple of different ways you can get there if indeed you're looking to sit for the exam. And Susan, I'll have kind of talk through these a little bit. We've got little check marks so that you can kind of see the difference. But really, the big question that we get a lot is, why would I do one versus the other? Why would I do non-credit versus credit? And then you can kind of see the different tiers of the two credit off. It's the same offering, but different credit levels, I suppose. But maybe let's try to answer that question, and then that might help students to be able to assess which one they might be right for them.
It's such a great question, one we get a lot. And one of the things that I love about UVM is that we have a lot of flexible options. One of the things that's a challenge is that there are a lot of options, and trying to figure out which one is best for you is a little bit challenging. But rest assured, non-credit and credit are the same core material. We are teaching the same thing. In the credit program, you get grades. In the non-credit program, you have a pass or fail for your assignments. So there is those slight nuances. People who are taking the credit program might be folks who are looking for credits towards a degree of some type. Perhaps you're getting a master's or an undergraduate degree. Our undergraduate students, it can be a minor for them at the University of Vermont. It could be someone who works for the university who has tuition remission. You could take our programs and the credit program for free to be able to continue. And we've had a lot of student advisors, wellness ambassadors, folks come through our program and found that it enhances their ability in their communication as well. In 8 credits, you will be ready to sit for the national board exam. With 15 credits, you get the University of Vermont academic certificate. Really what that means is that you have a transcript that shows that you completed an entire academic certificate there. Right. the 8 credit, from the 8 to the 15 credit, what you're adding on is those elective classes, those different types of things. People who take a non-credit start or base can still take classes in the credit program afterwards. They can't sit for that 15 credit certificate program unless they've done the credit version of the other part. But there are the classes like the practicum and the professional development classes that we have that you can take at any point during that. And our fall cohort for our credit program is being offered online in person. And that one starts at the end of August. It's Monday mornings in person at the Osher Center. So if you're someone who really likes in-person interactions, this was our first cohort that we went through since COVID started last fall. And those students were like, I don't know how I could learn this any other way. They enjoyed being in person. Our credit program is a mix of undergrad, graduate students, and professionals. So there's a wide range of ages. And, you know, we've had everyone from 18 to 65 years old in our class, and they mix and support each other amazingly well. The credit program's a little bit more spread out. There are more breaks that are in there. At Christmas time, you will be off, you know, mid-December until mid-January. The non-credit program, we push you through a little bit faster. You'll see the start and end dates. They start later, but they end earlier. And the non-credit program is in the evenings. It's virtual. It's 100% virtual online. We do have synchronous class times every week, 2.5 hours. Most of that time you are spent practicing in breakout rooms. So don't worry, you're not sitting there listening to lectures. It's more of a flipped classroom. There's work that you do in preparation, and there is work. This is not just I'm just going to log in on Tuesday and see what happens. There's several hours of work that you would want to do to prepare to get the most out of the program.
Such a great overview. Thank you so much. And I do see quite a few questions coming in. And we're just about 2 slides away from the Q&A. So I'm just going to zip through these last pieces and then we'll get to all of your questions. Thank you, Susan, for going through that. So I love this slide because our students pass that exam. And so we prepare you very well to sit for the National Board Certification exam. So, but there's a little bit of nuances there, Susan, to be able to do that. Could you just go through that quickly?
Yeah, once you're finished with the program, you do have to have at least an associate's degree or higher, or 60 college credits completed to sit for the National Board exam, or 4,000 hours of work experience. I haven't done the math to figure out how many years that is, but they do say it's in any field. And I know Diane was asking about professional backgrounds, where people come from. If you have no background in health and wellness, does not matter at all. I went through a program with someone who ran their own business selling ice cream out of a truck. And she came in and went through the health and wellness coaching program. Anyone who wants to help people live a healthy life and learn how to create intrinsic motivation can come through this program.
Yeah, that's such a great, thank you, Diane, for asking that question. I also love this slide too, because it's like, well, what can I do with it? And we're seeing a real growth, and maybe, you know, our folks attending have been as well, of businesses really saying it's a lot about prevention. Let's do some programming. Let's bring in a staff member that's focused on the health and wellness of our employees. So I think we're seeing a lot more types of positions that our integrative health and wellness coaches could go into at businesses. But and then a lot of other ones that I kind of feel like, oh, okay, I could see that. I could see those athletic trainers, nurse practitioners, and physical therapists. But is there anything else here, Susan, that you just wanted to call out that you're seeing?
Yeah, the ones on the left are where UVM actually has a health and wellness coach embedded. All of those places we have active health and wellness coaches. The ones on the right are folks who maybe want to use health and wellness coach as a skill in an already established profession that they have. So they might not be doing pure health and wellness coaching, but they're using motivational interviewing and all of these as a part of their practice. Yeah. Health and wellness coaching billing, I see Wendy's question on that one. There are CPT codes that are category 3 CPT codes right now, meaning that they are out there and the national board is working actively to try to get these to permanent codes with a reimbursable rate. Right now, there is no reimbursement rate for those. It is up to the insurance company whether or not they use them. And that is something that we're working towards. Yeah. We are billing for health and wellness coaches at the pain clinic because of a bundled payment policy, but bundled payment program that is in place. So right now we're working on that. But right now, the only way you can bill is if you work with a healthcare organization, and you can't do it in private practice. You can't bill as a health and wellness coach unless you're affiliated with a organization, and then still it's up to the insurance. It's a little bit confusing on that one, but yes.
Yes, it's not an easy answer, but I suspect she probably knew that when asking that question. and happy to, as you see the email on the screen right now too, please, if you have additional questions and follow up, we'd be happy to get those answers and get some feedback from Susan and the team as well. Jody asked what level of math is involved in this program and also the test.
I just finished stats class, and if I never have to do math again, I'd be happy. There is very little math that is involved on that or within the test.
I love that answer. Sherry asked, is there help with financing? I think it depends. I would love, Sherry, for you to email us and with a follow-up question about that. Susan, I don't know if you have an answer to that. I have a little bit of a caveat answer to that.
Not that I know of. We had Upskill Vermont funds, but I don't know if Upskill is offered again this year, which I don't think it is. So right now, I don't know if there is any other funding. We were looking at having scholarships put in place through the Osher Center for BIPOC populations or other types of folks to try to get folks into the program. So if money is an issue, I would reach out and see what type of support we might be able to provide.
Yeah, please do reach out, because I do know there's a few answers that other folks have related, but it also depends on if you're looking at the credit or the non-credit. That's why I was not sure. So it'd be really great if maybe you shoot us an email and we can help get a little bit more information. I wanted to come back to the question about the winter break and the vacations, because we understand planning is important. Yes. And so I just wanted to zip back to this slide again here. To note the retreat dates and the break, and hopefully that answers that question you were looking for, the non-credit.
It is important to note that this class does end and begin with a full day retreat on a Saturday. The 2-week break is at the winter holidays. It's Christmas week and New Year's week for the non-credit. And there is a study guide that we provide to take the exam. That the content outline is something that we provide. We have a whole course, a 1-credit course devoted to helping you prep and study for the national board exam. So we provide all of those.
Great, which is probably why we get to this wonderful percentage, because we want you to succeed.
We do.
Yeah, Stephanie has 2 great questions that I can answer. The bottom one real fast. Registration's open right now. For the fall, we would absolutely love for you to apply for either the credit or the non-credit program, whichever one you're interested in. We typically open anywhere between 4 to 6 months in advance. You know, we try to open as early as we can. And it is currently open. So that's exciting if you're interested. And then I'd love, Susan, what are your thoughts on Stephanie's other question?
100%. Something offered in a correctional setting. Health coaching is accessible anywhere. And I think I actually have heard of some folks who have put a health coaching program into a correctional facility already. So I know that there are ways that this could be used in almost any setting. It was started by the VA, had a very large coaching program, and I'm close with the folks at the VA and following their progress as they're implementing health coaching into a lot of their clinics there. They have some fantastic models and lots of different places that it could be.
I love that too. That's such a great answer. And it looks like Erica's asking, how many classes a week are there? And I think you're also on the non-credit, if I'm following the same string of questions. And meaning live classes, I'm kind of assuming. So Susan, maybe just touch on this one more time.
Class just meets 1 day a week. So Tuesdays from 6 to 8:30 for the non-credit and Monday mornings for the credit program.
Awesome. And then Thea, what is the average number of out-of-class study hours for the non-credit? Great question.
We say about 5 to 10 hours outside of class a week.
Great. And
During the second half, you're doing some actual coaching. So it's scheduling time to coach your peers and to coach another person through the coaching series, as well as videos, study guides that you're working on, and books. We have 2 or 3 different books that we use: a motivational interviewing book and a coaching psychology manual.
love all these questions. They're firing at us. Aaron says, are there any restrictions for out-of-state applicants? No. I'm pretty sure that's an easy answer. And go ahead.
Well, for the credit, is there, the out-of-state tuition, they pay in-state tuition? I don't 100% know for the credit program.
Yeah.
But
Where did I have that pricing there? One more, there we go. Why don't you, Aaron, why don't you shoot us a note? Let's just clarify so that we're very clear on out-of-state cost. I think that it has either variable tuition or our professional and continuing ed tuition rates for this program. But if you want to shoot us a note, and you can also chat on our website too. Those are real people, our enrollment coaches. Okay, non-credit, great. So no, there is no difference in the non-credit pricing for in-state or out-of-state. So that was an easy solve. You're welcome. No problem. And then Stephanie's, oh, great. Just a thank you. Department of Corrections and having a coach within our department would be amazing, right?
Yes, get in touch with me, Stephanie. Let's make that happen.
Oh my gosh, thank you so much. So I want to be just respectful of everybody's time. I know that everyone has probably jam-packed days. Hopefully this has been informative for you and you're excited to join either the credit or non-credit cohort starting in August, or late summer, early fall. As I mentioned, applications and registration is open for all of those 2 options. It's an amazing program. It really is. I've heard from so many students who've completed it that it's life-changing. So you're changing not only other people's lives as you embark on this career, but I think you're changing your own life too, from what I've heard. So thank you, Susan. It's always so great to learn from you. And I can't wait to see what students join you to learn from you again this fall.
Thanks, Nicole. Thank everyone for being here. Thank you, everyone, for being here.
Take care, everybody.